Mentioned, I'm going to try to link those animal models into what we know about the human condition. I have no conflicts. So there are a number of challenges, as you probably can imagine, in terms of linking animal models. The diagnosis of most bladder disorders are indeed symptom-based, while their pathophysiology is really not so much understood. And as mentioned, as we'll discuss, chronic pain is not complex. It's not constant. It's very complex. It varies from patient to patient. It's not really a reflex response to an acute stimulus. So animals, while animal models are indeed difficult to link, oftentimes they are necessary. They're necessary to test various hypotheses in terms of the etiology, the pathophysiology, the natural history, and even the therapy for a disease. For animal model to inform treatment of human beings with the naturally occurring symptoms, the data obviously must be relevant to anything that we're planning to model. There are a number of helpful criteria, which include face validity, the similarity between any type of model and a disease, construct validity, the extent to which a model has theoretical rationale, and predictive validity, which is a similarity in response. So that being said, there are a number of animal models that are currently used, and we've used a number of these. Most of these are induction of a disease in an otherwise healthy animal. So there are a number of models of acute abdominal and pelvic injury, as well as local installation of a variety of types of irritants. And although while these are incredibly useful for understanding underlying mechanism and they're necessary, they're really limited to demonstrating bladder and nervous system response to a noxious chemical. There's irritation of other pelvic organs, and of course, these are also necessary and useful. They help explain the presence of a number of comorbid disorders in patients. But in many types of models, when a stimulus is removed, healthy animals appear to return to normal. So the absence of a noxious luminal agent in human disease and the acute time course make a lot of these studies difficult to relate to patients with very chronic abdominal and pelvic pain syndromes. Another group are the spontaneous occurring disease, and we've used these. The feline IC model is one. There are many others. Also experimental models of stress and pain that we're also using. Stress, we know, induces and maintains hyperalgesia. It enhances the effects of pain-producing substances. So all of these models, and there are many types of these stress and pain models, they support the known effect of adult stress on symptom severity and the presence of other comorbid conditions, including the non-bladder phenotype, as Phil mentioned. Bladder pain, as we know, is likely to develop in multiple mechanisms, either alone or in combination. And there's a huge number of components in terms of mediators, and they're typically called inflammatory soup. Some of them are shown here. These combine to produce increased excitability of pain fibers, nociceptors, resulting in a hyperactivity or pain. And you should note that there are more than 100 chemical entities currently being explored for the treatment of chronic pain symptoms. And this is not just bladder, but other types of chronic pain, really demonstrating the unmet and urgent need for this kind of therapy. Now, there are a number of findings of animal models that really support or very similar to the human condition, and I'll just give 3 groups of examples. One of these revealed defects in the urothelial layer. And so some of them that have been described using a number of animal models. The images I'm showing come from the feline IC model, but this is obviously used in others. There's been a desquamation of urothelial cells and increase in permeability. There is a slow turnover or regeneration of this urothelial cell layer. There's an increase in what's called von Brun's nests. These are proliferating urothelial in the underlying lamina propria. And there's an increase in angiogenesis and neovascularization. That's what you're seeing on the right panel. All these little yellow asterisks are next to the formation of these functional microvascular networks. And in some cases, this may actually involve angiogenic factors that can induce glomerulations during hydrodistension. So anytime you have this kind of dysfunction, this leads to a compromised urothelial barrier, which can lead to increase in toxic substances penetrating this barrier, gaining access to the underlying nerves, resulting in urgency, frequency, pain during distension. So the goal of a number of these animal models is really to understand the mechanism for these changes, which may be due to altered levels of mediators or factors that we believe impair proliferation and the ability to repair. Findings from animal models also have revealed an increase in a large number of different types of mediators. And I'll just highlight two to mention. That's nerve growth factor, NGF, as well as ATP. Some of these may actually serve as predictive biomarkers, again, similar to the human condition. So just highlighting ATP in these examples, we know that in the bladder, in both patients and a large number of animal models, release of ATP by the epithelium and augmented again in pathology can lead to hyperactivity and pain. This just doesn't occur in the bladder. This also occurs in other organs, such as in the airways, where this can result in increase in hypersensitivity, hyperactivity that you might see in COPD and asthma. So the epithelium in general can amplify signaling in pathology. It can lead to increased afferent excitability, spontaneous activity of muscle, again, in a number of organs, obviously including the bladder. We know that stress and anxiety are major risk factors in the pathophysiology of functional pain disorders, including IC. Findings from animal models do support a role for increased stress and exacerbating physical hypersensitivity, visceral hypersensitivity. And again, this is very similar to the human condition. So what's been described in both animal models as well as in patients, there's an increase in something called the acoustic startle response. There's augmented urinary catecholamine levels, and there's an increase or change in the autonomic nervous system dysregulation. And this is just a snapshot of those factors that have changed. Both physical and psychological stress or stressors have been used to generate a number of different types of animal models, again, for stress-induced visceral hypersensitivity. And again, this includes studying a range of factors and mechanisms that can underlie both the initiation of these events and how it's maintained for a long period of time. So these models are very chronic. They do approximate the human condition. So can we reduce chronic pain? Well, we'd like to think so. So candidate therapy may be very effective if it targets more than one of the component systems, so multimodal, both central as well as in the periphery. And from bench to bedside, there are a number of findings in preclinical animal models that have paved the way for new clinical therapies. I talked about just a few examples, mediators such as ATP, nerve growth factor, but there are a number of others. And again, these can sensitize afferents, and they can result in urgency, hyperactivity, and pain. So some examples of therapies that diminish pain signals in animals, which may be very useful in humans, can include pharmacologic, such as the purinergic antagonists, P2X3, the NGF blockers, botulinum toxin, neuromodulation, and a large number of intravesical therapies. So in summary then, we really need to identify a number of pain mechanisms and targets that can participate in producing a number of clinical symptoms, and also consider factors such as gender and age. Few, if any, agents tested in induced models in chronic abdominal and pelvic pain have been translated into really effective clinical therapies, and that just doesn't apply to the bladder. That's across the board in chronic pain. So it's been said that reverse translational approaches may be a good approach, maybe not necessarily better, but rather than relying solely on the traditional approach of predicting human efficacy from some of the limited rodent models. And I just want to thank a number of my collaborators over the years and give a shout out to Tony Buffington, who's a professor emeritus from OSU and really developed the feline IC model, and I've been very privileged to work with him for a large number of years. Thank you very much.
Thank you, Laurie.